Hi, my name is Damila Nugmanova. I'm from Kazakhstan, president of Kazakhstan Association of Family Physicians. When I was a young student, I participated at the Alma Ata WHO World Meeting, which was in 1978 in Almaty in September in Alma Ata. And that time was a famous Alma Ata Primary Healthcare Declaration. But that time I was young and I understood nothing about primary health care, but I thought it was very important event in the whole world. And then my destiny brought me to the family medicine, and I started actually family medicine in Kazakhstan with my colleagues. And now I have to say that primary health care is so important, and for our countries, former Soviet Union countries, even in 78 it was a Congress was held in former Soviet Union, which was recognition that primary health care is well developed in former Soviet Union, and that is why it was chosen as a country where to do this WHO conference devoted to primary health care. But since that, nothing really happened, which is worries. Really, primary health care not a core of the healthcare system in our countries in former Soviet Union. In Kazakhstan, ambitious of our governments, they want to build huge buildings, and they call them polyclinics, and this like 5-story buildings serving 150,000 population. And my concern is that primary health care wasn't developed appropriately in our countries in former Soviet Union. In Kazakhstan, government thinks that if they build huge big building and they call them polyclinic, which serves 150,000 population, and you come to this big building and you disappear as a person, as individual, as family, because you have to go to that specialist, to this specialist. There's no familiar faces, no one who recognizes you as a person, as individual, and your health records are in different rooms kept it, and pediatrician serves your children, and internist serves you as adult, and if you're a pregnant woman, you are served by OBGYNs, and no common ground. And health information, we are losing a huge amount of health information, and no one who know what happened when you was a child, because records disappear. We don't know where are they, and this is something like industry, and it's no real primary health care in these buildings. And my concern that WHO even did a great step in 2008 and produced this good book on primary health care, but in that book there is no clear definition of primary health care. What does it mean, primary health care, and who is the center of the primary health care? We think as family doctors that family physician, general practitioners is a cornerstone, is a center figure of the primary health care, and the rest of team, nurses, social workers, health visitors, other people who work in primary health, they should work under the supervision of family doctor. And it is not clear who works in primary health care in all these WHO documents. They mentioned only nurses, and not clear what kind of doctor should work there. And our politicians, they use this for their own understanding of primary health care. For example, in Kazakhstan, they calculate as primary health care all specialty care, outpatient specialty care, ambulance, like a huge ambulance system, which is also very expensive. And in some regions of Kazakhstan, when they calculate how much money they spend for primary health care, and when they see that they do not spend enough money for primary health care, all money goes to the specialty care, they decided to calculate, to put into the primary care TB hospitals. TB system, which is also expensive, separate system, TB system. That is why we need from WHO clear definition of primary healthcare, who are working there, and also the size of population which is served by one facility of primary healthcare. This is crucial to us because these huge buildings and huge polyclinics, they can build one building for one small town, and they say that in one building they can serve 100,000 population of whole city, and this whole city should go to this one building, and they consider this as an excellent primary health care. That is why it's my concern, and I expressed on our WONCA World Council meeting. I love nurses, and they need to be recognized, especially in our countries. In our countries, nurses considered to be like servants to doctors, and I disagree with that, because I believe that nurses can do a great job, and if nurse will be a separate like specialty recognized in our country, it will be I'll be happy, and I'm fighting for this with our government, because government considers that nurse is a small part of the doctor, and that nurse means a doctor educated in 2 years education of medical school means you are a nurse. But it is absolutely wrong, my understanding, because nursing is a specialty, medical specialty, it's a separate medical specialty. But when we think about who works in the primary care, nurses, I'm not sure that nurses could work themselves, because they cannot produce these clinical guidelines. Maybe I'm wrong. Maybe it's like a chauvinistic, like doctor's opinion. But I think that we have to be clear that nurses should work under the supervision of family doctor as a team. And this teamwork in our rural areas, for example, one primary care facility where rural doctor works, and he has several nursing points where nurses work, but these nurses work together with doctor, because they cannot cover all conditions. Need always be in contact and under supervision, under the advice of the family doctor. That is why my concern that WHO should write that the core center figure in primary care is a family doctor, and family doctor decide how many nurses he needs, what kind of other health professionals needed to serve this population under his supervision, which are